Nipah virus. Nipah virus is a zoonotic virus that spreads between animals and people. It spreads mainly through fruit bats, also called flying foxes. It can also spread through pigs and other animals like goats, horses, dogs, or cats. How the virus spreads? 1. People or animals have contact with the bodily fluids, that is blood, poop, pee, or saliva of an infected animal. 2. People eat foods that have been contaminated by an infected animal. 3. People are in close contact with a person that has Nipah virus, usually while caring for them. The best way to avoid Nipah virus is to avoid exposure to sick animals, especially bats and pigs, in areas with known transmission. This includes avoiding food products that an infected animal can contaminate, like raw date palm sap, toddy, or fruit. Since the virus can spread from person to person through bodily fluids, you should avoid or take precaution when going near anyone with Nipah virus. Nipah virus can cause mild to severe symptoms, including encephalitis or brain infection and death. There's no medication or vaccine to treat it. Managing symptoms is the only way to treat Nipah virus. Preventing Nipah virus involves infection control measures like protective equipment and disinfecting surfaces, as well as avoiding sick animals or areas with known Nipah virus outbreaks. Where is Nipah virus found? Nipah virus outbreaks happen almost every year in parts of Asia, primarily Bangladesh and India. The virus was first discovered in 1999, when it led to 100 deaths in Malaysia and Singapore. Over 1 million pigs were killed because of the virus, which had a major economic impact on the countries. Since 1999, there have been about 20 additional outbreaks. You should take extra precautions when traveling to countries that are susceptible to outbreaks like Bangladesh, Malaysia, Singapore, or India. Other areas like Cambodia, Indonesia, Madagascar, the Philippines, and Thailand may also be susceptible to the virus, since the bat species that spreads Nipah virus can be found in these areas. Symptoms and causes. Initial symptoms of Nipah virus may include 1. Fever, 2. Headache, 3. Breathing difficulties, 4. Cough and sore throat, 5. Diarrhea, 6. Vomiting, 7. Muscle pain and severe weakness. Symptoms typically begin within 4 to 14 days after exposure to the virus. It's common to have a fever or headache first and develop respiratory problems like cough and difficulty breathing later. Severe symptoms include 1. Brain infection or encephalitis, which is life-threatening. 2. Confusion and disorientation. 3. Slurring speech. For seizures, 5. Coma. 6. Respiratory distress. What does Nipah virus do to humans? Nipah virus can be deadly to humans. According to the Centers for Disease Control and Prevention, death may occur in 40% to 75% of all cases. This depends on how well health officials can manage the outbreak. What causes Nipah virus? The first case of Nipah virus happened when people who were in contact with infected pigs began getting very sick. Researchers then determined bats were the original source, having passed the virus to pigs. If an infected bat or pig spreads its bodily fluid to another animal, they infect that animal. The same happens if people are in contact with the bodily fluid of the animal. This could be from urine, poop, blood, or saliva. Once a person has the virus, they can spread it to other people through their own bodily fluids. Transmission also occurs when food products are contaminated by fluids of infected animals. This includes fruit and raw date palm sap or toddy. People who regularly climb trees where bats sleep and rest have also been infected by Nipah virus. Is Nipah virus airborne? Yes, the virus spreads through respiratory droplets. This means it can spread through the air when a person coughs or sneezes. What are the risk factors for Nipah virus? The main risk factor for the virus is interacting with bats, pigs, and humans with a known infection, especially in areas with Nipah virus outbreaks. You should take extra care to avoid sick animals. Consuming raw date palm sap or fruit is also a risk factor, since bats can leave pee, poop, and other fluids on them. What are the complications of Nipah virus? Some of the known long-term complications include convulsions and personality changes. A small number of people develop symptoms months or years after exposure to the virus. Because the virus is dormant, that means you have the virus, but it's not giving you symptoms. People who recover from encephalitis may relapse, or get encephalitis again. Diagnosis and tests. A healthcare provider can diagnose Nipah virus by reviewing your symptoms and discussing any recent travel to areas where Nipah virus is common. During the first stages of infection, a healthcare provider can perform a real-time polymerase chain reaction, or RT-PCR test to confirm Nipah virus. Following bodily fluids are used to test RT-PCR. 1. Nasal or throat swabs. 2. Cerebrospinal fluid, or CSF. 3. Urine samples. 4. Blood samples. Providers can diagnose the infection in its later stages or after recovery by testing your blood for certain antibodies. This is called enzyme-linked immunosorbent assay, or ELISA. Management and treatment. There are no antiviral medications to treat the virus. This means treatment consists of managing your symptoms. This may consist of 1. Drinking lots of water. 2. Getting plenty of rest. 3. Taking acetaminophen or ibuprofen. 4. Using medications to control nausea or vomiting. 5. Using inhalers or nebulizers to improve breathing difficulties. 6. Taking anti-seizure medications if you experience a seizure. Researchers are studying using monoclonal antibody treatment for Nipah virus. Do people survive Nipah virus? Yes, people survive Nipah virus. But about 40% to 75% of people who get the infection die from it. This rate varies depending on the country's abilities to detect and manage the virus. Symptoms can range from a mild fever and headache to brain infection or death. Prevention. You should take the following precautions to avoid getting the virus. 1. Wash your hands frequently. To avoid any contact with sick pigs or bats. 3. Clean and disinfect pig farms. Animals with the virus should go into quarantine right away. Avoid trees or bushes where bats are known to rest or sleep. 5. Avoid eating or drinking things that may be contaminated, such as palm sap or fruit. Wash and peel all fruits before consuming them. 6. Throw away any fruit with bat bites or fruit that's touched the ground. 7. Avoid contact with the saliva, blood, or other bodily fluids of a person with the virus. Infection control measures. Infection control measures can also help prevent spread of Nipah virus. For example, if you're caring for a person that has or is suspected of having Nipah virus, you should always use personal protective equipment. Examples of PPE include 1. Isolation or full coverage gowns that protect against bodily fluids. 2. Medical gloves. 3. Eye protection like safety glasses or goggles. For medical or surgical masks. The style of mask may vary depending on the severity of the outbreak. In hospitals and other healthcare centers, healthcare providers should practice standard infection control protocols. The EPA recommends using Q-list disinfectants to disinfect and sanitize all clinical surfaces. By Joshi Joseph. Thank you.